Hi, this is Dr. Tayani, ophthalmologist and oculoplastic surgeon at the Tayani Institute. Today I wanted to talk about one of the most common things that we see in this world, and that's diabetes. Diabetes affects the eye, unfortunately, in a really bad way. So, as we all know, we want to try to control diabetes as best as we can. Hemoglobin A1C is a number that you should really know when your primary care doctor measures your does blood tests and measures your blood sugar. It's not so much the daily blood sugar, but it's the hemoglobin A1C, which is a measurement that is taken over an average of 3 months of your blood sugar. That number is very critical. You want it to be in the 5s and 6s if possible. I know that diabetes is a very difficult thing to control, and in some patients, even if they're at 7 or 8, they might be very happy with. So that's something that is a whole nother discussion, and really mostly with your primary care doctor. But from an ophthalmological eyeball standpoint, we find that if patients have diabetes, if it's early on, you want to be seen once a year. And more advanced cases, you might have to be seen every 3 to 6 months. But the role of an ophthalmologist is to see how the diabetes is affecting the eye, and there are some things that we could do once it does hit the eye to prevent it from getting worse. We have laser options and we have injections. One of my colleagues will talk more about this in a different video, but at a basic level, wanted to just make sure that you are aware that you need to be seen every 3 to 6 months if you have advanced diabetes, or once a year if it's very newly onset diabetes or mild diabetes. And if it's swelling at the level of the macula, the central part of the vision, then we can use injections or lasers to prevent it from getting worse. If it's some certain type of changes, bleeding or vessel growth into the eye, then we might do lasers in the periphery of the back of the eye to prevent the blood vessels from growing further. So, major thing to remember is have an eye exam on a routine basis and try to control your hemoglobin A1C. It's Tayani from the Tayani Institute. Have a great day. Till next time.